Good afternoon, everyone. My name's Manisha, and today we'll be doing a webinar which is an overview of implementing and evaluating injury management programs. Just a little bit about me. I'm actually a physiotherapist by profession, and I've been a National Injury Management Advisor for the last 6 years. Part of my role is also looking after the health and wellbeing program, early intervention and sustainability programs through my organisation. Prior to that, I was a senior rehabilitation consultant, and prior to that, I was working clinically as a physiotherapist. So some of the key learning outcomes that we'll be looking at today will be the field of injury management, the rationale for establishing an injury management program, the processes for establishing and evaluating an injury management program, and some of the evaluation techniques and strategies that we might use. So let's start off by looking at what is injury management. So the World Health Organization defines injury management as the process in the workplace designed to facilitate the employment of persons with an injury through a coordinated effort and taking into account the individual's needs, work environment, enterprise needs, and legal responsibilities. So not only does it involve return to work coordination, but all of the steps required to obtain a successful return to work, and also the interaction between return to work and rehabilitation, compensation, and prevention programs. So some of the definitions of injury. There's some subtle but important differences between injury, impairment, and disability. Why is it important to know this? Because in the legislation, depending on which state you're in, sometimes it can mean the difference between accepting a claim or declining liability for a claim simply by the way the legislation is written in regards to injury, impairment, and disability. So for many, the word injury conjures up images such as someone in a wheelchair as a result of an accident or suffering from a break or an amputation. Interestingly though, the most common injuries that affect working adults are actually soft tissue injuries, including sprains and strains. However, in more recent times, there's also been a sizable increase in claims related to stress and psychological injury. Impairment can be defined as any loss or abnormality of psychological, physiological, or anatomical structure or function, and it's an objective construct relating to loss of function. The assessment of impairment requires judgment of mental and physical functioning of the body and its component parts according to accepted standards. And disability in the context of a health experience is any restriction or lack of ability resulting from an impairment to perform an activity in the manner or within the range considered normal for a human being. Given that there's no way of rating disability and the very same injury can have very different implications for different individuals, this can sometimes be a harder area to try and determine liability for. Let's look at some of the impact of injuries. So when people do get injured, they're away longer from work than is necessary. Some actually never end up returning to work, though they could be productive if the working conditions were modified or suitable duties were provided. Some return to work and then cease again, as suitable duties are not sustainable or sufficient modifications within the workplace are not consistent with the worker's functional capacity, and they cannot be made or they're not able to perform the inherent requirements of their pre-injury role. And some remain off work as a result of an injury that could have been prevented if the workplace culture, policies or procedures had facilitated some ergonomic improvements or job modification when the symptoms arose. So what are some of the statistics around this? So according to the report from Safe Work Australia in 2012-13, work-related injury and disease cost the Australian economy $61.8 billion, which was 4.1% of the GDP. The majority of the costs, so 95% of those costs, were borne by individuals and society, where the workers bore 77%, the community 18%, and employees only 5%. And injuries accounted for $28 billion of that cost. If we look lower down, so you have a higher likelihood of getting chronic disease. This is within the Victorian Workers' Compensation Scheme. If you're off, you've only got a 70% chance of returning to work if you're off for 20 days. You've only got a 50% chance of returning to work if you're off for 45 days, and only a 35% chance of returning to work if you're off for 70 days or more. So the stats are quite alarming. So what are some of the consequences? So for workers, suffering from an injury can mean that it has social, financial, and impacts on your job prospects. So socially, you might feel isolated from friends and colleagues. You might experience a loss of confidence, a loss of identity, and it may have an impact on your family, including your children. Financially, there's significant financial impact because sometimes the workers' compensation payments don't fully replace your lost wage. Workers' compensation payments are often time limited, and you might not actually be accruing leave while you're in receipt of compensation payments. And from a job perspective, you may actually experience a loss of work status, currency of your job skills, work contacts, the confidence to actually perform in a workplace setting, training opportunities, and promotion opportunities. Furthermore, there's actually a cost to society when people do not have a wage or income. So as mentioned before, in most jurisdictions, workers' compensation payments are time limited. So many injured workers are forced at some point or another to depend on social assistance. This can have a devastating effect on the injured worker's quality of family life, their identity as a useful and productive member of society, and the amount of social contact and interaction they have with others. This also results in significant financial impacts on society as a whole. So, the field of injury management. So while the focus for injury management is on what's necessary to return an individual to work, people working in the field of injury management should also have a knowledge about related areas, including injury prevention, health promotion, compensation, and program administration. So injury management for individual workers is all about development and implementation of return to work plans and office of suitable employment, assessing needs, reviewing treatment, and liaising with stakeholders and coordination. So this is what we're familiar with. For an organisation, injury management is all about analysis of trends, cost-benefit analysis, policies and procedures. And for society, it's about them benefiting from the establishment of such policies that actually protect workers, decrease accidents, and are a lower cost to taxpayers. So why have an injury management program? So even for small companies, generally having some procedures for dealing with injured or ill employees, they generally do have some procedures, but there's several reasons why having a formal injury management program is worthwhile. So in the past, if a worker injured their back, the expectation was that the person would be off their job until the pain had completely gone and the injury was completely healed. So for many of these employees, they actually never returned to work or their jobs or to any job. And the bond between the workplace and the co-workers dissipated, and often individuals began to define themselves in terms of their injury. And it just became a negotiation between themselves and the insurer or the agent. Now, the research shows that the recovery tends to be faster and the likelihood of return to work increased if people come back to the workplace as soon as they are medically feasible, with suitable duties provided in which there are no risk of re-injury as they heal. So ultimately, the benefits outweigh the costs. For organisations, your workers, who are vital to your business success, will recover faster after an injury. You get to retain the skills and knowledge of your injured workers. You can reduce the cost of lost productivity due to lost time. You can reduce the cost of recruiting and training new staff to cover the role. You can also help build morale in the workplace by showing all of your employees that your injured worker is valued. You can limit the negative impact of the injury on your employer's reputation. And you can also reduce the impact of your claim on your workers' compensation injury insurance premiums. And, of course, the most important, that you're actually compliant with any legislative requirements by having the correct policies and procedures in place. And, in addition, most people are actually better off financially over time if they're working rather than in receipt of workers' compensation payments. Look, ultimately, prevention is the key. Some of the most effective ways to reduce injury costs to individuals and organisations is to prevent accidents and injuries through occupational health and safety programs and to encourage activities that enhance health through wellness promotion programs. So, liaison between the Return to Work Coordinator and other departments like your Occupational Health and Safety Department or your HR department to organise things like health and wellness promotion. Having correct procedures in place to identify workplace conditions early, which actually might create physical or emotional difficulties or exacerbate conditions that already exist, So an example of this would be like providing an ergonomic assessment for someone who has an acute sore back that you know works 8 hours a day at a desk-based job. So rather than waiting for them to take sick leave because they've got a sore back, the minute that they actually come to you and say, hey, I've got a bit of a sore back today, you can organise that ergonomic assessment and make sure that they're actually given the education and any sort of modifications that they may require to their desk or their workplace to make their job a little bit easier. And also, obviously, looking at health promotional wellness programs that can decrease the likelihood of illnesses that may lead to impairment, typically through interventions like you might offer financial assistance for stop smoking programs. You might have health checks that you do on site, any sort of education around health-related information. You might run yoga sessions on a Thursday morning before work. You know, any of those types of activities would be ways of educating people around health and wellness in your organisation. So early intervention, it's all about identifying and responding to those early warning signs and reports of accidents and incidences in the workplace. So responding early often prevents a worker from becoming ill, taking long-term sick leave or submitting a workers' compensation claim. So it's all about assisting the employee before the symptoms develop into an injury. So basically, it also sets expectations of an early return to work, which reduces the human and financial costs associated with workplace injuries, workers' compensation claims, and other forms of leave. So the earlier you notice a worker that's experiencing potential signs of ill health or injury, and the sooner you can take steps to help them, not only it benefits the individual, but also the team that they might be working in, as it helps maintain that cohesion. So what are the 7 key steps in early intervention? So making sure that there are clear policies or guidelines in place to support employees that show early warning signs of not coping at work. So this support should be provided regardless of whether the employee has submitted a claim or you haven't accepted one. Also, the line managers should be aware of early warning signs and how to respond appropriately. So this can be achieved through training, policy and guidance materials. Make early contact with the employee to offer help. Get early and expert assessments to identify the employee's needs. This comes back to that ergonomic assessment just as a simple example. The employee and supervisor need to be involved in developing and agreeing to a plan to allow the employee to remain or return to work. And if there's a psychological condition, it's making sure that the employee has access to effective medical treatment and evidence-based therapeutic interventions. So if you have an EAP program or you have discounted counselling sessions or any of those kinds of programs set up in your organisation, it's about offering this early to make sure that the employee is aware that these types of programs are available to them. And it's also providing flexible workplace solutions to support the employee at work. So for example, this could be something like travelling outside of peak hour, if they're coming in by public transport, for example, so they don't have to sit on a crowded train or stand in a crowded train, those types of things. So you might change their work hours, you might provide more frequent breaks during the day, you know, all of these types of solutions. So what is the biopsychosocial approach? So the biopsychosocial model forms the basis for the World Health Organization's international classification of functioning, disability and health, which is now actually widely accepted as being the framework for disability and rehabilitation. So it recognises that the injured workers' fears and beliefs about their injury and the impact of their return to work on their health are critical considerations for injury management. Likewise, the injured worker's level of motivation to return to work is often influenced by workplace variables, such as the presence or absence of support from their managers or colleagues, flexible accommodation and the availability of suitable duties, and of course the employee's willingness to actually invest in their health and safety. So the easiest way to think about it is biological, meaning the individual's physical or mental health condition, the psychological, which recognises that personal or psychological factors can also influence the individual's functioning, and social factors. So the importance of how the injury is in a social context, maybe the pressures and constraints on the individual's functioning in the work environment. So we're going to move on now to talk about how to set up an injury management program. So in order to establish an injury management program or to improve an existing one, it's really important to have the support of senior management. Furthermore, it's actually important to remember that a program won't meet with widespread acceptance unless employees at all levels of the organisation embrace it. So for this very reason, consultation with representatives from management, supervisors, line managers and employees is a really useful first step when developing a program. Next comes the needs assessment. So a needs assessment is a process in which information is collected to identify what currently exists, what should or could be put in place, and what the gap is between the current situation and what is desired. So a needs assessment can be supervised by a committee, if you have a committee, or it can actually be carried out by a staff member that's been assigned within the organisation, or actually an external consultant who's actually contracted to carry out the review. So there's some pros and cons associated with that. Using someone internally obviously has its advantages in terms of them being familiar with whatever the existing processes are and also the culture of the organisation. But sometimes using someone externally may actually provide a more objective view and without any preconceptions of what happens within the organisation. Additional to this, it's also really important to note that within the needs assessment, knowing what additional resources and what type of budget you may require is really important when you're actually putting that forward to senior management. So how are we going to gain this information? So some useful ways of gaining the information required for the needs assessment is actually just talking to people. So interviews with both internal and external stakeholders. So this might be, your internal people might be safety managers, any existing injury management or return to work staff. Union representatives would be a really good one too, because they're actually working on behalf of the employees. So if they've got any particular issues with the current procedures, then they may be able to feed that back to you. And of course, talking to your injured or non-injured workers. Some of your external stakeholders might be any sort of medical or rehabilitation staff that you come across or that you work with quite regularly, any other service providers that you use frequently, and of course your insurer agent or injury management staff from any other organisations. So this is often a really good one to do if you're actually networking within your industry. So looking at organisations that are very similar to the way you operate in size or the type of work you do, and having a chat to their injury management staff to see, well, what's working for their organisation? How can you incorporate that into yours? That can often be a really, really good way to go about it as well in terms of gathering information. Some other types of information you might want to look at would be collecting data. So things like statistics on claim costs, claim frequency rates, the types of injuries you're sustaining, what the effects are on your premiums. So maybe you can look at a set period of time, so over the last 5 years or something along those lines, and the total time lost in a given period due to injury. So these are just examples. It's not an exhaustive list. There's plenty of other statistics and data that you can look at. Reviewing documentation, so looking at any existing injury management or return to work policies and procedures, or examples of what employees are told about the injury management program and return to work during induction or any training sessions. So is this information relevant? Does it need to be updated? How old is it? Are all the contacts that are given still correct? Have staff moved on? It's basically doing a complete overhaul and a complete review of this type of information. And also knowing and understanding the discrimination, compensation and OH&S legislative requirements that are relevant to your jurisdiction and your employer size. Okay, we're going to look now at developing an implementation plan. So some education about injury management and return to work may be needed to be provided before decisions about implementation can be made. Injury management programs need an effective administrative structure. So this includes having appropriate policies and procedures, accurate tracking of costs and benefits, and regular communication with other relevant workplace parties. So this could be your employees, HR, any claims and rehabilitation staff, OH&S staff, senior management, your treating health practitioners, etc., just to basically support and contribute to the effectiveness of your injury management program. So once your needs have been identified, that plan, you need to plan ahead. So determine what the project structure is actually going to look like, determine whether an injury management committee is actually required, and then start looking at developing and reviewing the policies and procedures that are currently in place. So why evaluate? Evaluation is an important part of the injury management program as it determines whether the program is actually having the desired and expected effect. So effective injury management programs actually have a formal evaluation process in place. So this is normally on a quite regular basis. It might be every year, 2 years. So although a full evaluation may not take place every year, definitely ongoing program monitoring will occur. So this might be in the form of key performance indicators like the number of people away on injury or illness-related absences. These types of things might be monitored, say, on a quarterly basis through other forms of reporting. So it might be through your OH&S systems or it could be through your injury management systems. And in addition, assessments of specific program elements may occur if there's a problem. So, for example, if you're getting lots and lots of feedback from surveys from your employees that are actually saying that they're dissatisfied by the injury management program or the way that the managers are dealing with incidences and injuries or any of those kinds of things, so any sort of feedback that you might be receiving through other forms, that they actually may trigger a review of the injury management processes of policies and procedures. Excuse me. So next comes to planning the evaluation. So planning requires a systematic approach and can be seen through the following steps that are on the slide. So the idea is that a key to a successful evaluation is having a set of clear, measurable and realistic program objectives. So if the objectives are not realistic or they're overly optimistic and not measurable, you may actually find that the program is not able to demonstrate that it's been successful, even though you've probably done a good job. So it's really important to make sure that the goals and objectives that you set at the very start are in fact clearly defined. So once you have defined them, you move on to the planning stage, so identifying the evaluation activities, so how you're going to do the evaluation, who's going to carry out the evaluation, are you going to divvy it up amongst the committee members, or are you going to give it to specific people? Estimating the time and the cost associated with the planning phase and writing a plan for the evaluation. Next, you move to organisation. So decide whether you use quantitative or qualitative approach, select the types of tools you'll be using to evaluate the program, assigning the work activities and establishing a reporting process. Then you look onto the controls, so reviewing project schedule, making any changes to the evaluation process as necessary, and undertake an analysis of the data gathered. And then finally, you move on to the reporting stage, so actually preparing a report with circulation of the findings, conducting project review of the evaluation, and conducting a follow-up evaluation at a later date to find out if the improvements that you've actually put in place have occurred. So what are some of the evaluation methods that you might use? So qualitative evaluations provide information on the effectiveness of the processes and procedures and identify what is important to users and how they perceive the quality of the services provided. So this might be things like satisfaction surveys, document and file analysis, scheduled observations, interviews with stakeholders or focus group interviews. Whereas quantitative evaluations tend to draw attention to problems before they affect the outcomes, or they answer the questions of why outcomes have not been met. They can also point to the program's strengths and components that should be maintained or enhanced. So some more evaluation methods might be an outcome evaluation. And so this basically looks at answering the question of whether the goals and objectives that were set for the program have been met. So just important to note that goals are usually broad statements that flow on from your departmental or organisational mission statements. So a goal might be, for example, to contribute to organisational effectiveness by decreasing injury costs, whereas objectives are a bit more specific and they're statements that explain how the department will know if the goal has been met. So an example of this might be that, for example, there should be timelines that identify the period of time in which the objectives are achieved. So this might be, say, a 2% decrease in the duration of time lost from an injury over the next 12 months, something along those lines. You might look at some baseline data, so your demographic data, which looks at ages, gender and work type, the number and types of injuries, so this might be musculoskeletal injuries versus psychological injuries versus non-work-related injuries. You might also look at the average length of absence, so length of absence, maybe the type of leave taken by injury, for example. Looking at the cost of programs, benchmarking and normative data for comparison. So often with the normative data and benchmarking, you might be able to grab this information from your insurer if they're able to provide you with information about similar organisations. Or, if you're looking specifically at premiums, they might be able to give you some information about how that's actually calculated across the board. You might look at doing a cost-benefit analysis. You might look at process evaluation, interviews and focus groups, and of course, auditing. So how are you going to implement the evaluation? So steps in this particular process would be to specify, select, refine or modify project goals and evaluation objectives. So what is the general focus of the evaluation? What are you evaluating? Why are you evaluating it? And who is the evaluation for? So knowing who your audience is. You've established your standards where appropriate. You plan appropriate evaluation design. Select the types of methods that you are going to use to complete your evaluation. Collect all the relevant data. So what information will be gathered? Who's going to collect it? Who are you going to collect it from? And how will that information be gathered? Look at processing, summarising and analysing the relevant data. So how will this information be analysed and interpreted and by whom? Having contrast data with evaluation standards and criteria. And then, of course, reporting and feedback to those results. So how will those results be communicated? Who will they be communicated to and by when? So this will help you in determining your timeline. So the evaluation report, so a full formal report might be required by your management team to be presented to the organisation, particularly if you've got particular recommendations which might need to be considered and approved for implementation. So often if you're recommending, say, the introduction of a health and wellbeing program or a specific component of health and wellbeing program or early intervention program which may require resources and budgetary allocation, et cetera, you need to have that solid evidence to back that up. So if you're presenting it to senior management, you've got all of the information you need to make your case as strong as possible. So best practices are practices that have already been identified as being crucial to the success of a program. So some areas that have been identified as involving best practices include having guidelines for early contact and intervention, having written policies and procedures that cover areas such as transitional work planning, gradual return to work, how options to remove barriers are requested and implemented, maybe having a job bank, or things like substance abuse treatment. The case management process and whether it includes a central contact point of information about assistance with financial benefits and entitlements, treatment and rehabilitation community resources, and having other support services and return to work. Having a multidisciplinary approach to return to work that ensures that employees' needs in a range of areas are considered. Having inclusion of line management supervisors in return to work planning. Communication plans and processes for informing employees, service providers and others about the program, having documentation and records management. So this includes issues of confidentiality, data collection and analysis, and the effectiveness of any computer software that you might be using. Union involvement and consensus building in the area of injury management. So this actually helps in terms of making sure that the union, if you do have a union involved, are actually across what you're trying to do and keeping that whole process as transparent as possible. So by having a union on board, it means that they will then also help you instill that confidence in your employees that whatever thing you're trying to implement or whatever program you're trying to implement is actually for their benefit, and it's in their benefit to actually be compliant with that type of program, and also have their input so they make them feel that their opinions are valued. And of course, having injury prevention programs, so safety, ergonomics, health promotion, and linkages with your employee assistance programs. So some examples of some best practice guides can be found across nationally. So, for example, some of the guides to look out for, there's a guide published by the Seafarers Rehabilitation and Return to Work, which is a best practice guide that can be found at care.gov.au. I believe Comcare also have one available, a better practice guide for senior managers and supervisors. And also QComp in Queensland has a really good guide out, which looks at helping you get the measure of workplace rehabilitation. So I've got those resources up there. So if you are interested in having a look at them, please do visit those websites and take a look at what information is already out there. So in summary, effective injury management programs are built on some key principles, including early intervention and early contact, collaboration and communication between stakeholders, having empathy, creativity, and an interdisciplinary approach to services, workplace-based interventions and support, and involvement of employees and management in developing and maintaining a program. Injury management is beneficial to both injured workers and employers, and injured workers are more likely to remain at work with their pre-injury employer, and employers retain the skill and experienced workers and minimise the cost of overtime and replacements for injured and ill workers. In order to set up an injury management program, it's really useful to conduct a needs assessment to gather as much information as you can on the current and desired situation, as well as the goals and objectives to be met over a period of time and budget implications. And following on from this, an implementation plan that considers program structure, determines whether an injury management committee is warranted, and develops policies and procedures and should be developed. And program evaluation, which is an essential part of administering the injury management program. Program evaluation in injury management is important because it provides information on whether the program is meeting its goals and objectives, and whether the processes and procedures are efficient, effective, and that various stakeholders are satisfied, and whether the program in fact makes a valuable contribution to the organisation. So hopefully by now you should have an overview of the field of injury management, the rationale for establishing an injury management program, the processes for establishing and evaluating an injury management program, and some of the evaluation techniques and strategies that you might use. So this overview actually forms part of the Certificate for Interpersonal Injury Management. So for more information, or if you really enjoyed this particular topic, you can actually complete this module or learn more about this topic at www.pief.com.au. So does anyone have any questions?
Thanks, Manisha. We do have a couple of questions for you. The first is, based on your experience when it comes to management, what is the most challenging thing about introducing an injury management program?
Look, based on my experience, I think one of the most challenging things about trying to introduce an injury management program to management is making sure that they understand how it affects their bottom line. So by presenting them with data of having an early intervention program or a robust injury management program versus not having one. And this often comes down to looking at statistics or data such as lost time injuries and the costs associated with those, not having suitable duties versus the costs associated with having people return to work on modified or alternate duties. Often looking at premiums, so over a period of years. So I can speak to this one personally. So recently, when we just did an injury management review at my workplace, it was really, really interesting to see that having a full-time resource, which was me, come on board 5 years ago with this particular organisation, that they ended up actually only paying their minimum premium for the next like in the last 5 years, they've only paid their minimum premium, as compared to previous years where premiums were really quite high. So to me, that was a really clear indication that, having that dedicated resource on board, which was looking at sort of all aspects of an injury management program and really sort of coordinating that and making sure things were running smoothly, can actually have a direct impact on their bottom line. So that to me has been one of the most challenging things about trying to introduce something that, senior management perhaps are not necessarily, they don't think it's the highest priority in terms of a business.
Mm-hmm. And another question for you, what happens if you don't have a budget for health and wellbeing programs?
There's not a problem, because there's actually a number of free resources out there that people can actually tap into. So I, once again, was in a very similar situation where we were having budgetary issues, and one of the first things to go was the health and wellbeing program. But it was as simple as tapping into, because I work in Victoria, so jumping onto the WorkSafe website and having a look at actually what they've got on offer. So some of the resources that I ended up using were things like having an ambassador or a health nurse come out and actually speak to our group about diabetes. So that was through Diabetes Australia, I believe. And they came out for free. We've had events such as prostate awareness, so the Beyond Blue campaign. We've had mental health people come out and speak to us about that. Ovarian cancer. We've had ambassadors come out and once again speak to our group for free in regards to that type of information. It can be something as simple as, for example, if you work in the city, providing people with information about going like for walks at lunchtime, so organising a walking group, which would be something really simple and doesn't require anything. Simply putting out an email to everyone saying, hey, we're actually organising a walking group that starts at 12:30, goes till 1 o'clock or something, and actually provide people with different walking routes around the city. So that's just a really simple example of something else that we've done. I guess another thing would be to sort of, pick and choose your battles. So if there's one program that you really, really want to implement, you might be able to push that one through, provided that you're able to show that, you can continue doing the rest of your program on a really, really low budget and it's not really going to cost very much. So there's some really simple examples of ways that you can still encourage health and wellbeing within your workplace.
Okay. And how long does it take an injury management program to be evaluated?
Depends on what you're evaluating and how much. So it really depends on sort of what types of questions you're really asking. Generally speaking, I would say that for, say, a medium-sized business, it would generally take probably up to somewhere between 6 and 12 months. And it also depends on what resources you have available to you. So if you've got an external consultant coming in that's doing the whole thing for you, then obviously they may be able to get it done much, much quicker because you've got a dedicated person that's working on it, all the time. Whereas if you're doing it internally and you've got people that are, part of the committee, but that's not their only role within the organisation, then you're working around, organising meetings, trying to make sure that everyone's workloads are not, overly impacted by this additional research that they have to do into the injury management program, even data collection. So if you've got data that's, all over the place, managed by several different people, even just that data collection process can take quite a bit of time. So, it is variable and it does depend on a number of different factors.
And it sounds like this is all tailored towards bigger employers. What about the smaller employer?
Probably the information that we have provided in today's overview, I guess it probably would generally be targeted at middle to large employers. However, smaller employers can most definitely take on all of this information and implement it as best they can. So all small employers should still be looking at whether or not they're meeting their legal obligations. That's definitely the first thing to be looking at. and also making sure that they do have correct policies and procedures in place and tapping into any resources that may be available to them. So this could be their biggest resource probably, especially if they're not familiar with return to work and the whole injury management program, would be their insurer or agent contact. So, you know, having a chat to them, seeing what sort of training is out there for small employers, to basically upskill the staff that are actually looking after the return to work side of things and making sure that they have all of the tools and resources that they need to do their job if they ever were to come across an injury. Having a good incident reporting procedure is a really important one. And there's actually lots and lots of resources available to employers through the governing website. So, for example, WorkSafe Victoria. So they have lots of information about obligations for employees, employers, you know, step-by-step processes and procedures of what needs to be done should an injury occur at work. And yeah, as I said, there are still lots and lots of resources that small employers can tap into to make sure that they are covering all their bases and ensuring that whatever means of an injury management program that they do have in place, that it is in fact being effective.
Fantastic. Well, I think that concludes any of the other questions today, Manisha. I'd like to thank you very much for your presentation, and thank you to everybody that's listening. Everyone that has registered for the webinar obviously will receive a recording of the webinar. So thanks again, Manisha.
Thank you very much.